My name is David Baker and I work at a clinic called East Sydney Doctors. So there are a number of models of care for looking after or managing people living with HIV. And one of these models is shared care. And I'll just at this point read from some of our resources about shared care. So one definition we use is that HIV shared care is the joint participation of GPs and specialists and the planned delivery of care, informed by an adequate education program and information exchange, over and above routine referral letters. There's been ongoing debate about what shared care is. So there's basically the other two major models. One is GP HIV care. This is where the GP provides HIV management and prescribing and so on. And the other model, which is a common model, is the specialist HIV model, in which a specialist clinic of ID or immunologist or sexual health would provide the HIV care, and the GP would refer to that. A shared care model, though, is for patients who are receiving a lot of their care in general practice as well as in a specialist setting. But there is an agreed upon education program and exchange of information in a more structured way. So I think we hope that this model will result in improved follow-up of people, higher level of retention and care, and better health outcomes. So shared care tends to be something that is a little bit harder to organise than the other models, because this requires communication, which is always difficult in the healthcare system because it's so complex. So Ashram has had a long-standing interest in improving shared care and has a shared care project and training and resources. Well, really, Ashram is providing resources, and these would be always used differently in different locations, depending on the interest of the GP and the local services that they were wanting to share care with. We have based the shared care program around the existing Department of Health Medicare chronic disease management items. So these are actually built into Medicare, and they provide a structure for the management of chronic disease, including HIV, of course. So we have designed the shared care program to use these resources. And there's several reasons. One is that there's evidence that they improve the management of chronic disease, particularly a study on diabetes has shown this. And they also allow some funds to be provided to the doctors who complete these items. So it helps to fund the additional costs involved in creating management plans.